lesson is going to cover the physical and pacal peripheral nerve stimulator. A peripheral nerve stimulator, also known as a trainer 4 monitor, is used to assess neuromuscular transmission when neuromuscular blocking agents are given to block musculoskeletal activity. By assessing the depth of neuromuscular blockade, peripheral nerve stimulation can ensure proper medication dosing and thus decrease the incidence of side effects. Peripheral nerve stimulation is most commonly used for ongoing monitoring in the intensive care unit. Regularly during CCAS missions, we often administer our patients paralysing agents, so we need to be able to operate and maintain this piece of equipment. So during this lesson, we are going to orientate ourselves to the device, do a pre-user check, and then go through the functions of how we use this device. In order to orientate ourselves to the device, you will see the key components up on the screen. What we're going to move on to now is doing a 373 pre-user check. The first thing we're going to do is the physical checks, and we need to confirm the following. We need to check there is no dirt and damage on this machine. We're going to have a little look at the TMW asset number. We are going to check it has an MDSS serviceability sticker and that it's in date. We're going to check our ECG electrodes are in date. The next thing we're going to do is check our lead integrity. So at first we're going to look at our internal leads. So we're looking for any damage, any cracks or anything on any of the adapters. Then we're going to have a little look at our external leads, and again looking at the exact same things, just checking our integrity of them, making sure they're in good working order. The next thing we need to do is remove and examine the batteries from this compartment here. So with the battery compartment, we're going to be looking again for integrity of the battery compartment. We're going to check for any cracks or any missing parts, and we're going to check any heat damage or anything like that on our batteries and look for any leaks. As you can see, the peripheral nerve stimulator works with 3 AA 1.5 volt batteries. So the first thing we need to do is attach our external simulator lead. So we're going to attach our red lead into the proximal. We're then going to attach our black lead into the distal, like so. What we then need to do is create a short circuit. So we'll do this by holding these two together like so. And then what we're going to do is we're going to press both the external button and the on-off button at the same time. And what we're listening for is a 2-second tone, which will be audible. And then we should hopefully see on the screen that it comes on in external. So I'll show you this. So we can hear that tone, and then we can see that it's displayed external. We then need to set this at 10 milliamp. So we do this by pressing the up button, and then we can see now on the screen that we've got this set at 10. And then we're going to press the 1 second twitch button, like so. We should be able to hear audible twitch, which we can, and then a visual indicator with each pulse, which we can see here on the screen like so. And we just say that they're confirmed. The next thing we need to check that there has been no display of a low battery indicator. And then we need to check that this little triangle is stuck here, pointing here at the repeat button, which it is, and that the external indicators are present. The next thing we need to do is disconnect the free ends. We should hear an audible half-second monotone when it does this, and then there should also be a continuous tone, and then an error indicator displayed. So we can hear the tone, the continuous tone, and that we can see that the error indicator is now displayed onto the screen. So what we're going to move on to do now is the internal lead safety check. So without switching off, remove the external leads. And the alarm should continue, which it does. And then we're going to insert our internal leads. So exactly the same as the external leads, we're going to create that short circuit again, like so. And then we're going to switch on using the on and off button. Then what we're going to do is we're going to set this milliamp at 2.5. And then we're going to press the 1 second twitch button. So as before, we should be able to hear that audible twitch and the visual indicator with each pulse. Once we're happy with that, we also want to confirm again that there has been no low battery indicator. And again, that this is set at repeat, and this is saying that this is internal leads that are present. So the next thing we're going to do again is disconnect the 3 ends. There will be no audible alarm this time, but the error indicator will be displayed. So as I disconnect, there is no alarm heard, but then we can see the error is indicator there. Then we're going to reconnect the 3 ends, repeat an internal indicator is once again selected. And then the final part of the test is just to switch off, like so. Okay, so sometimes you might be required to reprogram this device. For example, when it's come back from NDSS or the batteries have been removed, the programming will need resetting on it. So to do this, what we need to do first is turn it on in external mode. So if you remember from before, press and hold the external and the on button at the same time. And then what we're going to do is press the program button, and then you'll see that this P will flash. And then you're going to scroll with the arrows up to high or low. So if we go to the high, we've selected that, and then this will select high, and then we can scroll up to 80. Once we get to 80 and we need to get past this, we need to double click all the way up to 160. So 160 would be the maximum current that you can deliver in external mode. And then if you wanted to set the low limit, what you do is you press the program button again. You'd see that it's going to flash. And then we would go to the low button. So what we're going to do now is cover the functional use of this machine and connecting it to a patient. For the purpose of this, I'm going to demonstrate this on myself. So any superficial peripheral nerve can be stimulated, but the ulnar nerve is a commonly used site. So what I'll do is I'll just pop this together first. So again, as before, proximal lead into like so, and the distal lead into the black. So the next thing we're going to do is ensure the skin is dry. You can use an alcohol wipe if necessary. And the next thing we're going to do is pop the ECG lead dots on. And then about 2 centimeters up, about there, like so. The next thing we're going to do is attach the external leads to the electrodes. So we're going to do red to head, so towards me, and then we're going to attach the black ones onto here, like so. And then what we need to do is turn this machine on in external mode. So the next thing we want to do is we're going to set this at 40, and this is what we would do within CCast. So what we're going to do now is record a train of 4, and what I'd be looking for would be to see 4 twitches. So as you can see there, I had 4 twitches, but what we would be looking for would just be the 2 twitches to say that we are adequately blocked. So once the patient is paralysed, the train of 4 is then performed hourly until the goal is achieved, and then 6 hourly. What we'll do now is just discuss some of the other demand functions that the peripheral nerve stimulator has. So obviously we spoke about the twitch and the train of 4, which we have seen delivered in this video. This one here is the tetanic mode, and you can see on the screen a bit more information about it. DBS stands for double burst stimulation, and then we have the PTC, which is the post-kinetic count. So this peripheral nerve stimulator also has the internal leads, which we discussed earlier. Routinely, these are used to locate nerves, but this is not something that we do within CCast, so we won't be discussing this within this video. Just some final useful information just to remember about the PNS. So as we discussed earlier, it has 3 1.5 alkaline batteries, which gives you a capacity of 160 hours, and they're to be replaced when the battery low indicator lights up. The operating temp is 0 to 35 degrees, and if you need to clean this piece of equipment after patient use, you can just use your normal green Clinell wipes. This brings us to the end of our peripheral nerve stimulator lesson. I hope that's been useful, and thank you very much.